Joining me now for more on how we get our testing where it needs to be, Dr. Ashish Jha, director of Harvard Global Health Institute and professor of global health at Harvard Medical School. I guess first, the idea of a phased-in, distributed, reopen the economy plan, how does that strike you?
That's good. When I looked at the plan, I said, okay, I like that. It should be phased in. It should be done slowly and done with metrics. So I think the conceptual approach to the plan sounded right to me. Then you get into the details where it gets a bit more challenging.
Well, that's the thing. The problem is, it's feels a little like my plan to dunk a basketball. I can plan to do that. I can plan a lot. I can practice, but can I do it? And that's sort of the question here, right? The plan of we have these metrics and we phase it in and we do testing, but getting to testing capacity is the big bottleneck. Is that how you understand it? Am I right? That's right.
Yeah, there are a couple of big picture issues with this plan. One of them certainly is, and maybe the single most important issue is the issue of testing. We fundamentally cannot. We can open up whenever we want, Chris. The question isn't that. The question is, can we stay open? Can we avoid massive outbreaks? We can't do that without substantial more testing.
And the other thing I keep thinking about is, it should be the case. There's a weird thing in this discourse. I think it's been driven a little bit by these protests and some of the president's propagandists, and a few kind of cranks on the right, that there's this inherent tension between the public health concern and the economy. But if you open up and there's a huge outbreak in a city and a bunch of people get sick at an office building and a number of them die, the economy is going to shut down. People aren't going to go to work. You haven't succeeded in doing anything if that happens.
Yeah, I've thought from day one this is a false choice for exactly the reasons you articulate. I tell people, imagine that the hospitals are overwhelmed, people are dying, nurses and doctors are getting sick and dying. You think people are going to want to go out to restaurants and bars and get on a plane and go to Disney World? Right. No, that's not going to happen. So we've got to fix the health problem. This was created by a health problem. We got to fix the health problem, and the economy will take care of itself. But the economy comes after dealing with the virus. And we can't deal with the virus until we know who's got the virus. And we don't know who's got the virus unless we're testing.
Do you have a clear sense? There was a huge ramp up in testing. In fact, at one point, it was almost exponential in a kind of an impressive way. It has appeared to plateau. The White House makes the argument that that's the lab processing has plateaued because there are more tests being run in hospitals. It's true that has expanded, but we don't think nearly enough. Do you have a clear sense of what the bottleneck here is? How to go from 150,000 a day to 1.5 million a day?
Yeah. So, we've been trying to first of all, estimate how many should we be doing? And our kind of best estimate is we probably should be doing 500,000-600,000 a day if we're going to have a shot at opening and staying open. So that's 3 to 4 times. So then the question is, what's causing that bottleneck? I've been talking to lab companies, states. I've been talking to anybody who's willing to talk to me about this to try to sort it out. The bottlenecks vary from state to state. Sometimes there's still states that get stuck on number of swabs. And again, I'm we're shut down at our economy because we don't have enough swabs. And what you find when you
wait a second. I've heard this too. Swabs. You mean literally the extended Q-tips? Not enough of the extended Q-tips?
Correct. So we can't test everybody we need to test because we don't have the right size Q-tips. And I think the economic cost of being shut down is so massive. And there are 4 or 5 things that are holding us back. And you would think somebody in the federal government would just say, we're going to throw whatever we need to throw at fixing these 4 or 5 things. And some states have lots of swabs, but not enough reagents. Other states have not enough reagents, but too many swabs. Seems like we could share. So again, there's a coordination issue. Right. There's a blocking and tackling problem. It's not going to get solved by 50 states all going it alone. And to me, the biggest disappointment in this report was the president said to the states, when it comes to testing, you're on your own. It's not going to work. We're not going to be able to stay open like this.
All right, Dr. Ashish Jha, it's always illuminating when we get to talk to you. Thank you for making time tonight.
Thanks, Chris.